What is urinary retention and bladder health? Have you ever wondered what urinary retention is and how it relates to bladder health? Urinary retention is a medical condition where a person cannot completely empty their bladder. This can happen suddenly, known as acute urinary retention, or gradually over time, referred to as chronic urinary retention. Acute urinary retention often comes on suddenly and can be quite painful, while chronic urinary retention may develop slowly and might not show symptoms right away. Bladder health is all about how well your bladder functions. The bladder is responsible for storing and releasing urine, and maintaining its health means it can fill, store, and empty urine without any discomfort. When it comes to acute urinary retention, symptoms can include severe lower abdominal pain, an urgent need to urinate, and even swelling in the lower abdomen. This situation is often a medical emergency and requires immediate attention. On the other hand, chronic urinary retention may not present obvious symptoms at first. However, over time, individuals may experience difficulty starting urination, a weak urine stream, frequent urination in small amounts, or a feeling that the bladder is not fully emptied. There are several causes of urinary retention. Blockages in the urinary tract, such as an enlarged prostate or bladder stones, can prevent urine from flowing freely. Muscle problems may also play a role, where the bladder muscles do not contract strongly enough to expel urine. Nerve damage, which can occur due to conditions like diabetes or spinal cord injuries, may affect communication between the bladder and the brain. Certain medications can interfere with bladder function, and pelvic floor disorders may also contribute to urinary retention. Diagnosing urinary retention typically involves a medical history review, physical examination, and tests like ultrasound to measure how much urine remains in the bladder after urination. Treatment depends on the cause and type of urinary retention. It may include catheterization to drain the bladder, medications, surgical procedures, or pelvic floor muscle therapy. Maintaining bladder health is crucial. Recognizing symptoms early and managing conditions that affect bladder function can help prevent complications like infections or kidney problems. Urinary retention can sometimes be a symptom of bladder cancer or prostate cancer, particularly if tumors obstruct urinary flow. Those with bladder cancer may experience urinary retention due to tumor growth or the effects of treatments like surgery or radiation therapy. To preserve bladder health, it is important to monitor urinary symptoms and manage any side effects from cancer treatments. Following medical advice can help maintain bladder function and improve quality of life. In summary, urinary retention is a significant issue related to bladder health, characterized by incomplete bladder emptying. It can arise from various causes, including blockages and muscle or nerve problems. Staying aware of symptoms and seeking timely medical care is essential for preventing complications and supporting overall urinary health.